So, as the city is facing the threat of the COVID-19 global pandemic, he helps supervise the risk communications team together with the city PIO and CTPIO and push for the creation of the upgraded communication center of task force COVID-19 Zamboanga that established hotlines and helplines to address various concerns of the affected populace, including the management of updates via social media. When he was at the age of 27, he also became the youngest ever appointed school administrator of the Colegio de la Ciudad de Zamboanga and currently heads the city's special events team. He is also the co-chairperson of the Zamboanga Hermosa Festival for the 5 consecutive years. He served as an executive assistant to City Mayor Isabel Orbeng Climaco from 2013 to 2017, handling youth affairs, communications, and interfaith relations, and became the designated liaison officer in the USED programs implemented in Zamboanga City. He also served as a political affairs assistant at the House of Representatives in Quezon City from 2010 to 2013. He is a part-time teacher at the Ateneo de Zamboanga University where he graduated honorable mention with a degree of Bachelor in Science in Mass Communications and currently completing his Master of Arts in Governance and Development in the Ateneo de Zamboanga University. He also completed executive courses on strategic planning at the Development Academy of the Philippines in Pasig City, and he is one of the 5 outstanding Zamboangueño young leaders for 2009 and took home the first Tayo Awards for a Zamboanga-based organization when he was the president of El Consejo Atenista. He is a multi-awarded debater, public speaker, journalist, development worker, and peace advocate, and a delegate to various international programs in the United States, Indonesia, and Thailand. And his academic papers are published in research journals across Southeast Asia. Again, let's welcome virtually Mr. Christian Alaceban. Sir Christian,
Hello?
okay, yan. Naririnig na po namin kayo.
Yes.
Uh,
All right. Can everyone hear me? All right. Of course, I'd like to say thank you first to our organizers. We are very happy to know that this is a collaboration of at least 5 student councils, particularly of the different colleges, particularly nursing, all over the city. And we once again congratulate you for this initiative. More than that, I'd like to also greet everyone, our listeners, to all the participants who are here, more than 200 of you. Buenas tardes a todos. Bienvenidos and assalamualaikum warahmatullahi ta'ala wa barakatuh to our friends from the Muslim community as well. This talk really is just a discussion of adjusting to the new normal, looking at the macro level, particularly our communities and our city in general. And we will also go down to the micro level, looking at ourselves, particularly how we are adjusting to the current state of the city and of this pandemic affecting all of us in many different ways. First, I'll be sharing to you a PowerPoint presentation to help us guide in the discussion and for us to have a clear picture of the local situation. I'm broadcasting live from Zamboanga City Hall. You all know that City Hall is closed for the past few days, given that we are no longer spared from the pandemic. We have at least 2 employees, based on our statistics, that were infected by COVID-19. And just today, I'll be sharing to you our new statistics as well. Hindi pa to na-anunsyo sa FB page ni Mayor Beng, but before we will release it, I'll be sharing to you our new statistics as well because hindi pa kami nakapag-release ng current advisory since we are still fixing patient data. But more than that, as we move forward, very important to understand is to look at Zamboanga City and where we are. No? To contextualize the new normal, Zamboanga City is the center of education. We have a lot of students and schools here. We are also the center of trade and commerce. What happens to Zamboanga City can have an effect to the entire Western Mindanao and the surrounding provinces of Basulta. More than that, we are also the closest neighbor of our ASEAN friends, particularly Malaysia. And all of this will have an impact overall in the management of the pandemic. When you look at it, the statistics in Tawi-Tawi, Sulu, and Basilan, for example, Zamboanga will have an effect, no, kung paano tataas ba or bababa yung bilang ng mga cases as well in these island provinces. More than that, the wave of stranded Filipinos, particularly from Sandakan, going home to the Philippines through Zamboanga as the entry point will also have an effect towards our statistics. And all of this is something that can affect us. Exactly why we have to contextualize the new normal looking at this context. Moving forward, Zamboanga City is also the host city of the Zamboanga City Medical Center. Paano to makaka-apekto? Because CCMC is a tertiary catchment hospital in the region, meaning patients from all over Western Mindanao and Basulta are brought here in the city for consultation, etc. And in fact, when you look at the statistics in Basilan, yung mga first COVID cases nila doon are dialysis patients who came from CZMC and went home to their island provinces. Therefore, nakikita natin how CZMC as a hospital can also have an impact overall to the region and the rest of Western Mindanao and BARM. Moving forward, ano ba yung effort ng local government in this pandemic? Very, very important to understand is Zamboanga City since December already started creating a task group. In fact, there were meetings done as early as December. As early as January, naglabas na ng health advisories ang local government. Nagpakalat na ng mga flyers on the coronavirus. There were billboards and tarpaulins na nilagay sa ating mga entry points, particularly at the airport, seaport, and bus terminal. Pagpasok ng February, hindi pa man pumutok ang pandemic in the country, we already toned down the celebration of the Dia de Zamboanga, if you remembered. In fact, we also canceled the summer festival in the city as early as February and entering March. So maaga po, one of the few LGUs ang City Government of Zamboanga who implemented the enhanced community quarantine. Hindi pa po nag-ECQ sa Manila, pinag-usapan na po ang pag-close ng ating borders and implementing ECQ in the city. In fact, because of that, we created the task force COVID-19 in the city, and we created 4 task groups. One, we created the entry point quarantine. This is the group that is tasked to handle all our entry points, our seaport, our airport, and our bus terminal, and the entry points in Licomo and Limpapa. We also created the contact tracing group. We realized na eventually we cannot stop the virus coming into the city, kaya mahalagang magawa na to. In fact, we also created task group treatment and containment, including task group risk communications, which I'm part of. Because we realize, even during the Zamboanga siege, that communication is a form of aid. Ibig sabihin, more than just the need of having water or shelter or food during a crisis situation, mahalaga rin na merong impormasyon. Because pag walang information, hindi natin alam kung anong gagawin, anong mangyayari bukas, or ano yung nangyayari sa ating paligid, then we are not at peace. No? Kaya mahalaga rin that we communicate the risk and the crisis that is unfolding right before us. With regards to the creation of the task force, ito rin yung ating institutional mechanism or the structure that is in place in the local government to address the pandemic. Of course, we know Mayor Beng is on top of it, but we have different groups manning different concerns from peace and public safety, communications and advocacy, ang ating operations center, ang ating even price monitoring and commodities team. Nakita natin early on, nung March, ang taas ng presyo ng alcohol at ng face mask, nagkakaubusan. Kaya kailangan natin magawa yun. Supplies and logistics, making sure that we have enough food and resources in the city while we are on lockdown. Finance team, meaning kailangan rin ma-ensure na may pera ang gobyerno, at hindi lang ang gobyerno, but we have enough resources to finance all of the different interventions that should be done in relation to our response to the pandemic. We have group handling containment, entry point, transport and mobility, our coordination with the barangays, because our barangay officials are considered as well our frontliners in the barangay level, food and relief assistance team, contact tracing, and risk communication. So at least we understand that there is a framework in place or a structure in place to address the pandemic. And this is part of adjusting to the new normal, because we have to understand that all of this is part and parcel in place to help us address the pandemic in the city. Moving forward, we look now at our confirmed cases, but we'd like to inform you that what you see on the screen is not anymore updated, because this is as of this morning, but as of this afternoon, we have additional cases. We'd like to inform you, hindi pa po kami naglalabas ng advisory sa page po ni Mayor, but we'd like to inform you that we have 3 additional cases reported. We now have the total number of 359 confirmed cases in the city, not 356. And in terms of active cases, we have 158 active cases. Under the community, 82 na po. Under CRC-related, 21. LSI, 49. And returning OFWs, 9. And in terms of recoveries, 189. In terms of death, we have 12 deaths na po at hindi na po 10. We have 2 additional, I think, death statistics as of this afternoon. For the 3 additional cases na meron po tayo ngayong hapon, ZC357 is a 40-year-old female from Tetuan, close contact of ZC340, asymptomatic and admitted at Zamboanga City Medical Center. Our additional case is ZZ358, 75 years old male from Culyanan, who died on July 11, 2020 at the Mindanao Central Sanitarium due to acute myocardial infarction and community-acquired pneumonia high risk. And siya po ang ating 11th confirmed mortality. Additional po na statistics is ZC359, 38 years old female from Southcom Village with mild symptoms, isolated at Yuntes Center in Sinunok. And ZZ343 is our 12th mortality. Therefore, we have 12 deaths as of this afternoon. Ilalabas din namin maya-maya for the general public yung ating information na to. Kayo po yung pinakaunang nakarinig ng additional na advisory po natin. ZZ343, yung ating pong 12th mortality, is a 61-year-old female from Barangay Tetuan. So now, hindi na lamang po LSIs or ROFs yung additional cases natin. I think we all can say that there is already a sustained community transmission happening in the city. Therefore, mahalaga po that we follow all of the minimum health standards being implemented, not just by the local government, but our health authorities as well. Moving forward, we have to understand that as we respond to the pandemic, the local government has realigned budget. Ibig sabihin po nun, we have usually in the local government, budget for the year, like budget for 2020 was crafted or drafted last year. So ibig sabihin, dapat etong pera ng gobyerno may mapupuntahan ng mga proyekto and programa, but because of the pandemic, we have realigned it. Ibig sabihin, we canceled some programs, some projects, and we allocated it to the COVID response. So as you look into your screen, we have a total of 1.09 billion pesos from the local government allocated for the COVID-19 response. Napakalaking pera. And if we ask, saan ba ito napupunta? It is also in your screen. Let's look at it. Mahalaga that we understand that the local government, in partnership with ANENO, has created our treatment facilities, particularly the Ateneo de Zamboanga Lantaka campus. We're in all the confirmed cases with mild symptoms, with 60-bed capacity. We're all housed at Lantaka. And then for the moderate to severe symptoms are all housed at CZMC. We also created quarantine isolation facilities. Zamboanga Eco Zone, meron tayong 4 na buildings dyan na kinonvert into a quarantine isolation facility. And we have a capacity of 274 beds to cover that total number of patients in case tataas pa ang active cases and they need to be housed in these isolation facilities. And then we also have the Kabatangan Evacuation Center that was also converted into a quarantine and isolation facility with 50 beds. In the past, when we had cases at the CZRC or the Zamboanga City Jail or the Reformatory Center, We had tents as well that were put up in the area to also help isolate and quarantine infected persons deprived of liberty. And then our local hotels were also converted into quarantine and isolation facilities for our returning residents, particularly our LSIs and our returning OFWs who are quarantined before they are allowed to go home to their respective residences. Of course, we also have our border control. May mga checkpoints na tayo. I'm sure nakadaan na siguro ang iba sa inyo na nakalabas. Our curfew is also in place. It's also part of the new normal that we are adjusting. Dati-rate, nagkaka-curfew lang nung panahon ng Zamboanga Siege and maybe during the declaration of martial law in the entire Mindanao. Now, it has become part of our new normal that as early as 9 or 11 in the evening, we all go home and should stay at home because that's part of our protocol under quarantine. We also have control points on city boundaries and constant coastal and maritime patrol because bawal po ang biyahe ng mga barko, particularly passenger vessels are not allowed. Exactly why we have coastal and maritime patrol to be able to make sure that even the entire stretch of our coastline is also being protected from illegal entry, especially of those coming from areas na possible and meron ding local transmission. Of course, the local government in the in the mantra of the mayor wants to feed the hungry. I think marami sa atin in the first two round of relief assistance, naramdaman natin yon. May mga complaints when in the process, but we have addressed that. The two rounds of relief assistance provided to affected families in the city, we have covered 546 million pesos in terms of expenses that covered one, our first relief, no, 3 kilograms of rice and goods distributed to more than 180,000 poor families. And our second relief of assistance, 25 kilograms of rice or 1 sack of rice with goods to more than 277,000 families as of June 10, 2020. More than that, I'm sure nakita nyo rin sa inyong mga electricity and water bills na meron tayong subsidy from the local government na bawasan po ng 500 pesos yung ating mga bills, and that as a total corresponding amount of 90.15 million pesos from the local government as support to all of the households, no, in terms of your power and water expenses. Of course, nagbayad rin po kami ng hazard pay sa ating mga frontline personnel, including their allowances, expenses even on home gardening vegetable seeds, the purchase of medical equipment and medical supplies and materials were also covered by the budget of the local government. Moving forward to the next slide, we have a recovery and resiliency plan. We have lessons learned in the process na mahalagang ma-increase yung testing capacity ng local government that would cover molecular laboratories, complete equipment and manpower training, the need for additional training as well to our barangay health emergency response teams to capacitate our barangays to handle if there are cases of local transmission in their area. Pag mag-lockdown man yung certain aspect ng kanilang barangay or kung mayroong mga active cases sa kanilang barangay, they know what to do already. And many others. Maliban doon, we have a lot of challenges ahead. No? There is an increase in poverty incidence in the city given na maraming nawalan ng trabaho, maraming natanggal sa trabaho, maraming nawalan ng livelihood opportunities because of the quarantine. So, tumaas rin yung poverty incidence rate. There is also a threat of the resurgence of cases and we are experiencing that today. Nakita nyo na mas tumataas yung bilang ng mga positive cases. More than that, there is also an increase in morbidities and mortalities, but this is not as worse as we look at Davao or Cebu City. We still have around 12 deaths as of today. Aside from that, there is persistence of disinformation in media platforms. Maraming mga fake news na kumakalat, ang dami pang mga issues na kumakalat. Pag pumapasok pa yung usapan ng politika in the picture, then mas lalo pang lumalala yung sitwasyon. So all of this is part of the challenges we are facing as a city today. The deportation as well of more than 5,000 Filipinos from Malaysia at dadaan ng Zamboanga City is also a challenge. Inefficiency of data sharing and consolidation. When you look at different sources, iba-iba rin yung data na i-provide sa'yo from statistics down to treatment and management. Iba-iba rin yung nakikita natin. And unreliable power supply is also affecting still many of us in the city. Moving forward, mahalaga rin that as part of the new normal, Zamboanga City is one of the few cities in the Philippines na merong testing capacity. In the past, nung March, April, alam natin ang bagal-bagal pumapasok ng results. Kaya ang hina-hina rin ng takbo ng ating statistics. But today, napakabilis because hindi lamang yan dahil grabe yung infection, but more than that, because the local government has the capacity now to test massively our constituents. We have technically two operational COVID-19 testing laboratories. We have the CZMC DA laboratory with automated extraction kit and the CZMC Gene Expert laboratory. And take note, aside from these two laboratories, we have two other laboratories that will soon be operational. One is at the Red Cross and the other one is at the City Health Office. Ibig sabihin, mismong ang city government will also put up its own testing laboratory to help speed up and expedite the process of testing. Ibig sabihin nun, napakaraming lumalabas na positive at napakaraming suspected cases because the local government has the capacity to do that. When we have a confirmed case, for example, say ZZ103, for example, yung kanyang close contacts automatically upon contact tracing will be tested as well because we have the testing kits and we have the testing laboratories. In other cities, nakita mo napakababa ng kanilang statistics, hindi dahil sa walang cases doon, but they don't have the capacity to test. In fact, in other cities, hindi rin ganun ka-transparent na ang kanilang local government in terms of sharing data to their constituents because hindi nga, wala nga silang testing capacity at wala rin silang capacity to monitor their statistics anymore. Kaya when you go to other cities, like I had friends in Cagayan de Oro, when you ask them, ilan na yung positive sa inyo? They cannot answer because they don't have the data. Unlike in Zamboanga City, nakikita nyo na almost every day we communicate to our official media platforms through the FB page of the mayor, for example, and of that of the local government, so that you will all be guided kung gaano na ba karami ang infected, ang mortalities, nasaan sila, ano-anong mga barangay, at ilan na yung recoveries natin. And more than just ranting siguro with the mayor, bakit ganito ang sitwasyon, is we have to appreciate how we need to understand the statistics and how it can guide us and help save lives. Because with these statistics, we know ano na yung infection rate, alam din natin kung saan mga barangays yung mas tumataas yung community transmission, and alam natin what to avoid, where not to go, and where we can go. In the process, be more vigilant in protecting our families and ourselves. More than that, we have treatment facilities in the ANENO and ZZMC. When you look at it, when we look at our data, we have a high rate of recovery as well. I think recently we announced that we have at least 85 to 86% recovery rate for the city. At medyo okay yon compared to other cities na mas maraming mortalities because we can still manage our confirmed cases in the city at maraming gumagaling. More than that, na-mention ko na rin kanina that we have quarantine and isolation facilities in the city that can help us manage our cases. Moving forward, what are our emerging issues and challenges? Number one, we ramdam po namin ang inyong discontent and impatience while we are under quarantine. Alam natin na ang daming mga policies that even the local government, wala po kaming magagawa if it's policy from the national government. Even stupid mga policies ng paglagay ng protective barrier sa motorcycle na sinasabi ng karamihan, mag-asawa naman yan. Pagdating sa bahay, magkasama naman sila sa kanilang kwarto, bakit pa kailangan ng protective barrier? But even the local government sometimes is helpless because if this is a national policy implemented by the national government, all of the LGUs are expected to abide. What we can only do is recommend and share the feedback we get from our constituents. But at the end of the day, whatever policies that would emanate from the national government, we have to streamline these national policies and make sure it is being implemented by the local government. More than that, ang daming pang mga reklamo from many aspects. May it be lax ba yung gobyerno, hindi ba tama ang pag-handle sa mga umuuwing stranded individuals? Bakit ba 2 tao sa isang hotel room? Bakit ba yung curfew? Bakit ba na-lift yung lockdown sa Sunday? Bakit ba bukas pa rin ang KCC, etc. And many others. Lahat ng to nakikita namin at nababasa namin. And these are the emerging issues and challenges we have to address daily as you face the new normal. Hindi na po siguro posible pa na sasabihin natin that we will all go back to the past, because as we move forward to the future, all of the things that is happening now can change the way we live our lives. More than that, the influx of unfiltered social media content from various sources, napakarami. Question, sino bang mga pages ang pina-follow natin? And question, do we verify that what they post is official, verified by the local government? Because when you look at it, when you follow media, for example, yes, they report, but at the end of the day, their main source of information is still the local government. Kaya mahalaga po that we only follow local government pages, including legit media pages, and other pages na po ay hindi na po, dahil mas nako-confuse lamang po tayo. Again, when there are advisories and announcements, napakahalaga po that it should emanate from official sources, because even media stations will still get their advisories from the city government at no other source po, or other sources of information po manggagaling yung information. More than that, harmony of patient data is also very, very important. Kaya mahirap po if we get information from various sources and not from legit sources, because we get confused or sometimes we question already the local government. Sinasabi ng iba na minamagic na lang ba yung mga cases, or sinasabi ng iba na naglalabas lang kami ng cases pag palapit na yung deadline para mag-maintain tayo sa quarantine, at sinasabi ng karamihan that we want na mas tumaas pa yung kaso dahil may pera sa COVID. Take note, kami rin po as employees of government are also affected. We all want to have normal lives. Wala po kaming nakukuha sa sa mga positive cases, kundi additional work and challenge lamang po in managing this. We all want Zamboanga City to reach that point that will have zero cases. And you have to trust the process and trust the local government, because at the end of the day, we also want what you want. We all want to have a normal life where we are safe and our families are protected, because kami rin po ay tao rin, and we also have our own respective families that we all want to be safe as well. Moving forward, the United Nations warned the UN Security Council that the coronavirus is threatening international peace and security. Potentially, it can lead to social unrest and violence if our ability to fight the disease would be greatly undermined. Ibig sabihin po, it is not just the responsibility now of the local government or even of our health institutions and our frontliners, our doctors and nurses, but it is now the responsibility of everyone. Given that we have community transmission, kayo na po sa inyong mga kabahayan are already frontliners. Our barangays are already our frontliners. It's not just the city government, it's not just the hospitals now. Kayo na po sa barangay yung ating mga frontliners. We all have to contribute, especially now that I'm talking to nursing students who more than any other perhaps subsector would understand medical and health theories combined with management of and care, for example. You have to look at your edge, no? And look at how you can contribute as well, informing your families, informing your loved ones, informing your friends, informing your communities, and what can be done to help manage our situation. More than that, kami naman as an LGU, we lead not just in addressing our health pandemic, but it is really a multi-sectoral whole of city approach. Ibig sabihin, ultimo seguridad, ultimo checkpoint, curfew, ultimo anong nangyayari sa ating mga malls and department stores, sa mga sari-sari stores, sa mga restaurants and bars, sa mga daanan, sa mga komunidad, at kahit man sa karagatan natin, and many other aspects of the city is also being addressed by the local government. We are not perfect. We are not perfect. We commit mistakes in the process. There are gaps that should be addressed, and we need to better the process of managing the pandemic. But more than that, we also need your help, and we need each other to be able to combat COVID-19, to be able to feed again the hungry and heal the affected populace in the city. Moving forward, napag-usapan natin kanina is more on the macro level, looking at the problem of the pandemic and the new normal in the macro scale. Ngayon naman bababa tayo sa micro level, looking at ourselves and our families. Again, kanina we listened to doctors, narinig natin yung mga health standards, the minimum health standards and protocol that we need to follow. With the new normal, now we know we heard new concepts like wearing of face masks na dati hindi natin ginagawa. Social distancing is something that we do not understand in the past. Kasi tayo as Filipinos and tayo pag may mga barkada tayo, we usually socialize very closely to each other. Kahit nga sa pakikipagchismisan, no? Napakadikit natin sa ating mga barkada. And in that process, we have to understand now na hindi na ganon, no? In fact, if nakalabas kayo recently, you go to restaurants, iba na yung proseso. Kahit kung gusto mong makipag-date, bawal na yung face-to-face discussion in a restaurant because that's not allowed anymore. No? One seat apart, one table apart na habang kumakain kayo. And this is the new health standard now. Pag hand sanitize, washing of our hands, foot bath when you enter establishments, wearing of or bringing your quarantine passes. Ngayon, ang galaw natin is now controlled by schedules, which in the past, anytime or whatever, anong oras natin gustong lumabas or anong araw natin gustong lumabas, pwede na. But now, with our new health standards, we are guided by certain schedules and the need to have a quarantine pass to be able to go out. More than that, minors are not allowed to go out. Senior citizens are also not allowed to go out. Pregnant women are not allowed to go out. Our jeepneys, our tricycles, our taxi now follow certain health standards. Even our businesses, our malls now follow new health standards. At bahagi na yon ng buhay natin sa araw-araw sa mga susunod pang mga panahon. More than that, as part of the new normal, we now are facing technology-aided communication and learning, which our generation, millennials, and even yung mas nakakabata pa sa atin na Generation Z, mga nasa senior high school and below or junior high, tayong maswerte because more than any other subsector in society, the millennials and the Generation Z or Gen X basically are tech-savvy individuals. Nabuhay tayo na meron ng internet, no? Nabuhay tayo na may social media, and more than our parents and grandparents or the adults who are older than us, we understand the dynamics of these communication channels and platforms and applications in many ways that they cannot comprehend because of their experience. And we now also face technology-aided learning, di ba? WIMSU, Ateneo, and many other schools now encounter online classes that are being held in Zoom. Kagaya nito ngayon, it's a webinar na ginagawa natin online. We bring together schools, more than 200 of you together, and trying to learn from each other and from resource speakers na in the past ginagawa natin sa malalaking venues, can be a multi-purpose covered court or a convention center, and we bring together people and listen to speakers. Now, you are just in your respective households. Through the help of the internet, you're able to listen to each other and connect to each other. And that's part of learning. And that's part of the new normal now. Na ngayon, kahit nasa bahay na lamang tayo, we are able to communicate and learn from each other. More than that, we've seen new things, di ba? ORSEMs being held online, graduation ceremonies being held online, and many things na selling online, ginagawa na rin. Bartering, for example, are part of the new normal now na nabuo at naging trend because of the pandemic. But more than that, we also need to realize that communication, again, is a form of aid. Information has the same value as that of water, food during a pandemic. Pag walang informasyon, mahirap po at it can cost lives. In fact, now we all rely on information to be able to survive day to day because any form of misinformation or any form of fake news can kill a person or can infect the entire community. Kaya mahalagang maintindihan that communication is aid. And I challenge many of you who are listening now that you are nursing students who understand health theories, medicine and care, for example, and with your ability as millennials or as part of Generation Z to use technology, use all of this, no, to be able to help provide vital information and to help educate our adults because sila yung mas nahihirapan ngayon, sila yung mas nahihirapang mag-adjust because they're not used to what is new today, no? And kayo yung mas nakakapag-adjust. In the process, and looking at ourselves on a micro level, we also need to realize that we have to appreciate the now more than ever. Because we do not know that tomorrow, baka may COVID na rin tayo, baka yung ating kapitbahay, ang ating mga nanay at tatay, or ating mga pamilya ay mawawala na because our future is now unsure. And we have to realize that we have to appreciate what is happening day to day as we survive day to day. Looking at it, even if nasa bahay lamang tayo, in the past when we are young, wild, and free going out of our households, we don't have time for our families. Now, almost 24 hours nasa bahay lamang tayo. Appreciate that. And look at how you can maximize the opportunities being with your parents. If you love your parents, for example, or your relatives, or your siblings, which in the past you don't have the capacity to really take care of them because you're always out going to school or with your friends. Now is the time to do that. Appreciate the now more than ever. And more than anything else, value yourself and reflect on your inner core. We have to realize that today, um, we have to value more ourselves. Why do we wear face masks? Why do we practice social distancing? Why do we take vitamins, for example, daily? Because we love ourselves and we value our lives. But more than that, reflect as well on your inner core. When you are at home, um, and with the new normal, tinuturuan na lamang tayo na pwede ka lang lumabas to access essential. And what is essential in your lives right now? You have to reflect on that. Ano ba yung mahalaga ngayon while you are at home? And what are your interests and what are the things you didn't do in the past which you want to explore now? Work on it, diba? And mold it to master that craft. Marami ngayon naghahalaman, nagga-gardening, nagiging mga plantitos and plantitas. Ang iba gusto nang maging cook, nagluto sa bahay. Ang iba nag-aala more time with your dogs maybe, or more time to explore your passion and your interest for music or the arts because you have time to do what? To do these things. Therefore, practice it, harness your skills and your talents, and use that as part of valuing yourself and prioritizing what you want in your lives. This is part of mental health. I think we have a speaker next who will talk about it. But you know, kami in the local government, as we respond to challenges as well, we also value our inner peace and our mental health. And we do things that we want. I go to garden centers and buy plants. I take care of plants as well. I have a lot of dogs at home and they keep me sane. I cook for the family. And these are things that I cannot do in the past. And more or less nahirapan na rin gawin today because of the challenges that we have to report daily in City Hall. But more than that, we find time to also value our mental state. And to be able to do that is you need to value yourself more. And I think part of the new normal is also the concept of obedience. Ngayon, ang dami nating complaint because government protocols and health protocols control our movement and our day-to-day activities. Because in the past, we are used to freedom. We were taught self-expression and to assert our rights, no, in the past. But we have to balance that today with obedience, because at the end of the day, when you obey rules with the local government and that of national policies and even health protocols, when we listen to doctors and their advices, that can save lives and that can help protect our families and keep us safe. And at the end of the day, alam kong patapos na yung aking oras, and I think there will be more questions that will come in the process. I'd like to end with the concept that our generation is the new hope. That more than anything else, when you look at the total population of the city, more than half, we are the biggest, we are the most dynamic and the most dominant sector in society, young people, and particularly nursing students with your background, you are the new hope. And harness that potential and realize that the city, your communities, and your households is also your own to earn, to shape, and to lead. And you have to assert, no, in that process. So I think I'd like to thank again the organizers for giving me this opportunity to talk to our nursing students from all over the city. And I'd like to also congratulate you for the success of this collaboration among schools in the city. And we look forward to more opportunities like this that we can talk to each other, listen to each other, and learn from each other so that we create a more learned society that can make more sound decisions and that can help save lives and help protect our city and our families. So thank you very much.